be strategic with your moves, intentional with your actions, and efficient with your time. Alter the present and change your destination.
Hello, and welcome to the Art of Emergency Nursing podcast. This is where we share stories for inspiration, entertainment, and encouragement, because we all know emergency nurses have the best stories. Now here's your host, Kevin McFarland.
Hey everybody, Kevin McFarland here from the Art of Emergency Nursing. I hope this podcast finds you well. Thank you so much for listening to this episode. I appreciate you listening, and I hope you're subscribed on your podcast player of choice to make sure you don't miss an episode. A couple things I want to ask of you to do me a little favor. If you haven't done so already, please go to iTunes and leave a rating and review. That really helps the show out, helps the show get noticed. One of the most important things you can do is share this podcast with your friends and your peers. That, to me, is the most important thing you can do to help boost this show. Good word from you is gold to me. You're going to love the episode that I have for you this week. My guest today brings a lot of experience from the pre-hospital environment to the hospital and even flight. His experience includes ICU, ER, program management, and even education. He inspires his many followers on Instagram with his random thoughts and his words of wisdom. He motivates those around him not only with his words, but with his actions as well. You're going to love today's episode with my friend, Everett Moss.
All right, so my name is Everett Moss. I am from the city of Atlanta, Georgia. I was born and raised here. I began my career in the medical industry with the City of Atlanta Fire Department. I'm a second-generation firefighter. My father was a firefighter up until the time that he passed. I started in the fire service, and there was a requirement to become an EMT. And when I went to the station, I worked with a few medics who were really inspiring and, kind of created the desire in me to do more medically. And of course, it was, the normal progression in the fire service to go to paramedic school. So that's the route I went. During my clinicals, I got exposed to a whole new world of medicine that I didn't really grasp when I was in EMT. And it just, kept growing. And I decided at one point, after meeting an anesthesia assistant, that I wanted to leave fire service and do more in the medical industry. Along my way, I met CRNAs as well as the AAs. And through conversations with those different disciplines in the OR, I decided that nursing would provide me more options and opportunities. So I switched my trajectory, so to speak, and decided to go to nursing school. In the meantime, I left fire service and started flying full-time as a flight paramedic. And of course, that again exposed me to a whole new world of medicine that I hadn't had the opportunity to learn yet. And went through nursing school while flying full time. And when I got done with nursing school, I didn't get a job in the ICU like I originally had planned because I didn't want to stop flying. And I was a little more transparent than I probably should have been in my interview because I made it known that I didn't want to maintain a full 2-year residency. So they didn't offer me the job because they felt I had too many competing priorities, which I did. And a friend of a friend called me and said, "Hey, I'll hire you tomorrow in the emergency room because you're already a very experienced medic. We can do an abbreviated residency for you and 4 other medics because you all already have a lot of the skills that new grads don't come to the table with. So we'll put you all in a specialized residency so that you can get to practicing or to the bedside quicker, which we need." So I began my career as a nurse in the emergency room, and I kept flying as a medic until I was able to get enough hours to cross over, so to speak, to flight nurse. And along the way, I ended up getting onto the pediatric vascular access team, I left emergency room for a little while and went to become an EMS coordinator. And the EMS coordinator was basically a liaison between the emergency room and EMS. So
Nice.
I kind of had a blended role where I still had a lot of interactions with EMS, but I also could speak the language of the ER nurse as well. And of course, every time you're pretty progressive and aggressive in the industry, people seek you out for other opportunities. So I was sought out to be a burn and trauma program manager because the facility that I was at the time had a burn program, and they wanted to obtain level 3 trauma designation. So I went through the interview process, got that position, sat in it for a while, maybe about a year, and I really found myself not enjoying the industry anymore. At one point, I thought administration was my end game, but I still enjoyed bedside. And so I dropped back to a role of quality improvement in a level 1 trauma center, thinking that may give me some more enjoyment while stepping back from a leadership role. And nevertheless, it still wasn't. So one day I had a conversation with a good friend of mine, and they said, "You know what you need to do?" And I'm like, "No, what?" They said, "Well, you left to pursue anesthesia, and that was your goal when you got into nursing, and I think that's what you need to do." And I thought about it for a while, had a couple conversations with a few friends, went to my director and told her that I wasn't happy in the role. She wrote an amazing referral to the ICU. I transitioned about a month later to the surgical trauma ICU at the same level 1 trauma center and began putting all my focus and attention into pursuing CRNA school. Still flying the whole time, still working part-time here, part-time there. And here we are a little over a year and a half later. I still currently work in the ICU, PRN in the pediatric ER, as well as the IV team. And I just had my last shift flying this past Monday.
Well, congratulations on your career in flying, and congratulations on meeting that goal. A lot of people don't do that.
Yeah. I get that a lot, and I just tell people it can be done. You just have to really seek out the opportunities and really make it known that you want to do it. Because if it's a thought that just remains in your head, you'll be like a lot of people that I run into and say, "Hey, yeah, 10 or 15 years ago, I really wanted to do it, but I didn't know how. And now I just, I have this going on or that going on. So I don't think it's something I want to do anymore, but I wish I had." So I tell anybody, make it known, seek out the flight crews when you see them, ask them how, and really, really go out there.
I think there seems to be something about speaking your goals out in the world. There was a couple goals that I've had that when I actually verbalized it and said, I want to do this. And then it started becoming real, and then I started kind of pursuing those opportunities, and boy, they just lined right up for me.
Mm-hmm. I totally agree. I made a post on my Instagram page earlier today, and part of it was be strategic with your moves, intentional with your actions, and efficient with your time. Alter the present, and change your destination. So like you just said, I think it's really being intentional with those thoughts and speaking them out, writing them down. I've never myself created, a vision board, but I wholeheartedly believe that putting down where you aspire to be in front of you, and reminding yourself of that goal is a huge part of the process.
Absolutely. Now, so you have a kind of an interesting kind of way into nursing that I think probably a lot of folks who end up in the ER share. I think that there's a lot of folks that get into EMS. My background's EMS as well. I worked in EMS prior to being a nurse. I did mostly EMS in the hospital. Worked as a tech but certainly taught EMS for a long time. And I think going from EMS to the hospital seems to be a pretty common thing. How is nursing school for somebody who is working as a flight paramedic, was probably a pretty high speed flight paramedic, knew some stuff. What were your thoughts on nursing school?
So I went to an associate degree nursing program at a technical college.
Me too.
Yeah. So I think that sometimes the community colleges are a little different in their structure than the 4-year bigger university colleges. I think there's a little bit of, I'd say they're a little bit more relaxed in a sense from what I've heard about the schedule and the load. I'm not saying by any means that you have lesser of an education. It's just the structure of the program. So that was somewhat of a difference because I have a buddy of mine that went to one of those universities, and he pretty much had to go to school full time. In my associate degree program, we had 1 day of class, 1 day of clinical, and typically like a half day of lab during the week. So that made it somewhat easier for me to manage and be able to fly as a medic full time. As far as the content goes, being that I had worked in so many different areas, I was in the ER as a medic, on the back of the ambulance. I worked on a critical care transport truck with nurses and respiratory therapists, and I was flying as a medic. So I had a very broad picture in my head from the areas that I've touched versus some of the other guys that were in my program. They had only done 911. So for those guys, it was a little bit harder to adjust to some of the things, the nursing process, because anybody who's done EMS knows, we're kind of we understand and have a lot of knowledge on a lot of different things.
Absolutely.
But we're kind of fix it now. And if it, if it isn't going to kill them right now,
we got time.
Right. So it was hard to adjust to that nursing process and focus on education of the patient, delegating things to techs or, requesting orders for this, that, and the other. So some people struggled in that regard. Being that I had seen that side of it and grew to an understanding of some of it, that was an easy thing for me. It was easy to cut the switch on and off. And if this is how you want to do it, then that's how we'll do it.
Yep.
Even if I know how to do it, that's fine.
That's fine. We'll do it your way.
Exactly. Exactly. So
did that too.
Mm-hmm. Yeah. So that was the biggest thing. I'll tell you that my areas that I struggled with were the whole, growth and development and the theories and things that I just didn't pay attention to as a medic.
Yeah.
I really had to study on those areas. And I've never been a huge fan of like endocrine disorders or the endocrine system in general, other than diabetes and hypoglycemia,
Yeah.
So I really had to buckle down there. And then, of course, OB. I've never been a fan. I know a lot of times in EMS, one of the jokes that I've heard used often is, whenever we have someone that's in labor, they make the joke of say, how to fix that. I tell them, hey, look, hold this quarter in between your knees until we get to the hospital. A lot of medics are fearful, and rightly so, because it's not something that they get a lot of. So the obstetric emergencies is a area that I had to really pay attention to. But when I got to the cardiac, the musculoskeletal injuries and things of that nature, oh man, that was smooth sailing.
You're like, okay, I got this.
Right.
I'll never forget when I was in nursing school, and I was an associate program as well. And I remember, we got to our fourth semester, and they're like, okay, we're going to go over shock today. I'm like, all right, I got this. I'm like, I got shock. I understand shock. I teach shock. I understand it. I worked in level 1 trauma center for a long time, and I was like, okay, this is going to be easy. And I remember the instructor getting up there and talking, and I was like, I didn't understand any of what, okay, I was like, apparently I don't understand shock. Apparently I thought I know, but I don't know. And then I realized that it was somewhere in between. I certainly picked up some stuff, but there was some stuff that she was talking nonsense because she just was barely understanding it herself. So
right.
But now, was your program a medic to RN transition program, or?
Yeah. So the way I'm actually a clinical instructor at the program now that I graduated from, and I was the first medic to RN bridge at that school.
Good for you.
So the way it works is you have the traditional track that goes through fall, spring, and then they're off for summer. Well, during summer, the LPNs and the medics come in and they do like the whole first year crash course in a semester. You do a day of class, a day of clinical, pretty much all summer long. And then in August, you merge with that full track. So you finish the program with the full track students for the final 2 semesters.
Oh, all right. That seems like a pretty good way to do it.
Yeah. Most of the programs here in Georgia that I'm aware of are about the same. The bridge students have a semester or half a semester to kind of go over some things, cover the fundamentals in a very abbreviated fashion. And then they link with the traditional track and finish off the program. If I'm not mistaken.
Nice.
All of the programs here do that.
That seems like a pretty good way to do it. Certainly I know a lot of medics that would have benefited from a program like that, but so many end up going to just a traditional ADN program. So they end up spending 2 years getting everything. And that's fine. I mean, they got to do what they got to do, but they get out and they end up being phenomenal ICU nurses because, they have the medic background, and then add the nursing on top of that. They're like, should be like a fast track for an ICU nurse. So,
right. Exactly. Exactly.
Well, that's really cool. Yeah. I think it's interesting. The transition when I was going through, there was a young lady who was a medic, who was taking the ADN program, and she was so stuck. She had such a hard time. She was always saying, well, this is how we do it in EMS. This is how we do it in EMS. And they kept saying, you're not in EMS. Mm-hmm. You're not in EMS. You're a nurse now.
That's hilarious because the guy, now he since went back and completed a program, but there was a guy in my class who struggled the exact same way. And I tell you, that is the exact same thing he would say. Well, that's not the way we do it in EMS, or, medics, we don't do that. And sure enough, he flunked out first semester. Yeah. You have to be able to make that change, that crossover, and say, hey, look, right now I'm studying for the NCLEX, not the NREMT.
Yep,
so
exactly.
My focus is a different focus, and that's okay. I tell you, one of the best things I enjoy about having touched the areas that I've touched versus, be it PEDS, be it ER, be it ICU, be it EMS, is I've come to the realization that whole argument about who does what and why shouldn't exist, because in EMS, you do what EMS does.
Yep.
In the ER, you do what the ER does. In the ICU, you do what ICU does. There's no real argument of whether or not ICU can be ER or ER can be ICU, because they're their own specialty for a reason.
Yep.
Do I have my opinions about who can cross over better? Sure. But there are people who will struggle crossing over in every discipline.
Absolutely true.
Me personally, ER is still my preference. I've only been in the ICU a little over a year now. And can I do it? Sure. But I like the acute, emergent aspect of patient care. And I tell people, it's okay to like what you like. That doesn't mean you're a bad nurse or a bad medic or a bad whatever. It's okay to like what you like as long as you understand that there's more to it. And when it's time to do those other things, you do it.
Absolutely.
But I just truly enjoy that whole, I don't know what's coming next. It could be something very, very critical, and we have to get in and fix it. Like, I enjoy rapid response models, and I enjoy being the, trauma lead or code lead wherever I'm working, because I get to go in, have my fun, but it comes from being a medic or especially being a medic on a fire engine, because I used to be able to get on scene, play, so to speak. And then as soon as we're done playing, all right, we'll see y'all at the hospital,
That's right. That's right. Yep. Understand that 100%.
Mm-hmm.
So tell me about a patient that you took care of that changed the way you practice.
Oh man, that's a good one. It changed the way I practice. Well, I'll tell you what, for the sake of time, I'll tell you about a patient that I struggle with, and it changed my approach. Not necessarily the entire way that I practice, but in a way I can say that it did. There was a patient that I was called to fly out, and it started off relatively simple with it being I can't remember if it was a STEMI or an in-STEMI patient, but nevertheless, the facility that he was at didn't have the capability, so he needed to be transferred to a cardiac facility. Well, before we could lift off, the patient coded, and our normal practice was, if we were on the ground, we would go back to the ER, secure an airway or whatever we needed to do prior to lifting off. So that's what we did. Well, when we got back in, the ER physician decided that they would do the intubation. And you could probably guess how that went. Couldn't get him tubed. And so yet again, here I am having to make an attempt. Now, I think this was actually, I can't remember if this was before or after the incident I had when I was nursing, but couldn't quite get an airway on him. For some reason, we struggled with getting a supraglottic airway. We were trialing video laryngoscopy at this time, and I had never used a video laryngoscope before. And I didn't know at the time that a very grand view, I don't know how to paint that picture for the listeners, but if your view is really, really great with the video laryngoscope, the tip of your blade is probably too close to the glottic opening. And when you try to pass your tube, it goes every way but in. I wasn't really skilled with the bougie at this time. And I was, this was the first, I'd say, difficult airway that I had. And so after I made an attempt, the doctor had already made multiple attempts. I made an attempt. And at this particular facility, they were pretty rural and small. So a couple of the ground medics that happened to be there made an attempt. Well, the doc decided to trach the patient. It didn't go well. It didn't go well at all.
Wow.
And after all of this happening, weather was moving in. So we had to make a decision as to whether or not we could take the patient or we had to get the helicopter back to base. Long story short, we didn't end up transporting the patient. He ended up going by ground. And that particular call haunted me for, months, and it's been years now. And so I say that after that call, I really started paying attention to how I manage airways, making sure that I'm proactive instead of reactive, and which is one of my fascinations with anesthesia and the preparation that it takes to go into assessing a patient. And I would say the company that I flew with, they also took a very proactive approach when it came to managing an airway, really taking into the considerations of how to assess a patient that may present with a difficult airway, being proactive with having your assistive tools in case you are faced with a difficult airway, such as a bougie. Of course, making sure that you have your suction available, and just going through your complete mental checklist, or sometimes even a physical checklist when you're going into a procedure. So even though that particular patient was a airway situation, I think that it did make me look at all procedures that I go into, even my daily management of the patient, of really trying to have a mental checklist of things that need to be done and the way in which it needs to be done for a better patient outcome.
Makes sense. If you had to go back, what would you do differently?
Well, to go back to that particular call, there was a lot of things that were out of my control. Anytime, you're not or at least one of the lead clinicians in that role, it's kind of hard to dictate if you don't have a lead that's willing to listen. But I guess there was a couple key things that I now have been trained on. So I definitely know I would do differently. And that's one, simply positioning the patient. There's been so many, since that time, I became a cadaveric lab instructor. So outside of actual, viable patients, I've dealt with, countless of airways and real human tissue. And I've learned so many different ways that I can position the patient. And so something that can be applied or is applicable to everyone, including this situation and the listeners, is slowing down, assessing the situation, and being more methodical in your approach. I could have positioned my patient better. I could have slowed down and not, because we were already in a bad way, right? And a lot of times that's something that we teach EMS students is, not to run when you get on scene. Your running doesn't make the situation resolve any quicker, especially if you trip and fall on your way up to the patient. So slowing down, thinking the scenario through, even if it's mental, just thinking it through before making your attempt, and trying to really visualize the difficulties that you may face. So just changing your approach and understanding that it is an emergency, but it's not your specific emergency. So there's no need for you to emergently go through it and forget a few things along the way.
Makes sense. That makes a lot of sense. I think one of the things that I remember hearing many times, and I've told many people, sometimes you got to slow down to speed up. Sometimes, kind of being methodical and taking your time thinking things through, that'll get you a lot faster result than just rushing in there and trying to cowboy your way through something.
Absolutely. When I was a firefighter, I remember being a recruit, and they were teaching us search patterns, and they would say, in terms of search and rescue, they told us that fast was not always the best search, but oh man, now that I'm trying to repeat it, I can't. But it's similar to what you just said. Slow and steady is sometimes faster than, fast and skipping over something, especially when you're searching for someone in a, smoked out black building and you can't see where you're going. If you can cover a lot more space thoroughly if you have a plan, you do it slowly but urgently, as opposed to just swiping down the wall as quick as you can and missing a spot.
Yeah. How'd you like the firefighter role?
Oh man, so I just had this conversation earlier today, because people always ask me what do I like the best, and to date, I gotta be honest, being a firefighter was the best job I still have ever had. I mean, I absolutely loved being a firefighter. I cannot remember a time when I worked for the City of Atlanta Fire Department where I did not want to go to work. Like, even when I was on vacation, I still kind of wanted to go back to work. When I was sick, I was actually upset that I had to call off sick. I mean, I don't know if I don't think it was any one particular thing. It was a combination of the camaraderie. It was a combination of, I don't care what anybody say, that whole, heroism, the big red truck, the fact that all of the kids love to see you come rip up and down the street, that's a part of it. It comes along.
That's pretty cool.
Yeah.
That's pretty cool.
It really is. And then having kids, and then being able to say, yeah, my dad is a firefighter. I don't get me wrong. There's a lot of honor and respect in being a nurse, but it just doesn't ring the same. So
yeah, it's just different.
Yeah, it is. It is. So man, I really enjoyed it. I think I was pretty good at it. I shook up a lot of people when I left. They called me the golden child when I was there. And so no one ever thought I would leave. And when I left, man, it shook up a lot of people, but I still miss it. I'm still close with a lot of the guys that are on the job when I was there. I just was in the ER the other day, and a couple of crews that I came on with. Matter of fact, one was actually my rookie, and now he's a driver, and another guy that came on a little while after me, he's a captain now. So a lot of the guys have progressed and promoted, and I'm happy to see them doing good. And yeah, sometimes I really do miss the job.
I tell you, I've worked with a lot of firefighters, and boy, there's a lot of people that just love that job.
Yeah, it is.
and just whatever job you love, if you love your job, boy, it makes it easy to get up and go to work in the morning.
It really does. It really does, man.
And that's like the best feeling ever. I mean, there's been days, and I think everybody has days where they're like, geez, I got to go to work. But if most of the time you're like, I got to go to work, it's going to be all right. It's going to be a good day.
Mm-hmm.
You're going to have fun. Then that's pretty awesome. That's really pretty awesome. What's the best advice a nurse mentor ever gave you?
Oh, let's see. Best advice a nurse mentor ever gave me. Well, I have a single piece of advice that I was given before, and I'll share that one, but I'm trying to think specifically a nurse mentor, because honestly, surprisingly, most of my mentors were mentors when I was a firefighter. And one of my biggest mentors, that's a nurse, he was actually a firefighter and a fire chief before becoming a nurse. But
Okay.
I want to think about, an hardcore, never wasn't into the fire service, um, nurse that gave me some advice that I can remember.
It's kind of funny you mentioned, when I was, I had my EMT intermediate, or what now they call the EMT advanced. I had my EMT, and I was trying to figure out what I was going to be when I grew up. And I was still kind of on the fence about, a few different things, trying to figure things out. And I went and applied for a paramedic for the paramedic program. So I was like, well, I really wanted to be a flight nurse was my ultimate goal.
Mm-hmm.
So I was like, well, I'll go get my medic and I'll become a flight medic. So this guy named Larry Cobb, who was, one of those, like the guy you mentioned, former fire chief, former nurse, longtime paramedic. He became a paramedic after he became a nurse, interestingly enough. But volunteered in fire like long before that. He was the program head for the paramedic program, and he did interviews with everybody as they were coming in. And he asked me, he said, "So Kevin, why do you want to be a paramedic?" I go, "Well, I think ultimately I want to probably be a nurse. I think I want to be a flight nurse. I think that's the goal." I go, "Yeah, I just figured I'd get some paramedic experience, and that'll help me in nursing school,
Mm-hmm.
and and then maybe I can fly as paramedic, and then ultimately fly as a nurse." And he's like, "Okay, so you want to get your paramedic so you can fly and ultimately become a flight nurse?" I said, "Yeah." He goes, "If the ultimate goal is to be a nurse, why not just go be a nurse?"
Mm-hmm.
And I was like, "Huh, I don't know."
Right.
He goes, "I'll give you the advice." He goes, "I'll give you the advice I would give my son if you were my son." He's like, if you become a paramedic, most paramedics that aren't doing fire, that aren't doing, they aren't going someplace where they're going to get a pension and they're going to retire. Most medics stay on the truck for about 5 or 10 years, and then they kind of burn out.
Mm-hmm.
He goes, and then they either go into education. He goes, "You already teach." He's they go into administration. He's like, "You've already done that." He goes, or 3, they leave the profession altogether. He's like, so that's the 3 tracks for most paramedics, like one of those 3 tracks. He's like, as a nurse, if you get tired of working in the ER, you can go work, med surge. You get tired of working med surge, you want to go work a clinic, work Monday through Friday, you can go work Monday through Friday.
Mm-hmm.
You want to work 3 days a week, you can go work 3 days a week. Yeah, you have more options. He's like, if you think ultimately you want to be a nurse, he goes, I'd say go be a nurse.
Mm-hmm.
And I was like, huh. And he goes, I'll let you in. He goes, if you want to get in the paramedic program, you're in. He's like, well, we'll make it happen. He's like, but he goes, I don't think you want to. So,
Right.
and I was like, huh, that's pretty good advice.
Yeah.
So, and it kind of changed my trajectory. I was like, okay, maybe I do just need to go be a nurse.
Uh-huh. Yeah, I've told, and I'm still going to come back to your question, but I've told several people that because, I still know a lot of people in the EMS community. And sometimes I go back to the school and talk to the students, and I get that question a whole lot from EMT students. And their question is, should I go to medic school and then go to nursing school, or should I go to nursing school and, then go the opposite way? And I'm like, well, here, and that's my advice to everybody. I mean, if you need, I tell them, if your circumstances can allow you to go to school full time to get your nursing, while I'm a huge advocate for being a medic, if the end goal is RN and you can go to school, do it, but
what are you doing?
Right. But if you're telling me that, hey, I got these prereqs I have to get, and I have this, that, and the other, and, I need to be working here, there, or elsewhere, or I can't really afford it, then yeah, sure. Go, because, a lot of medic programs are shift friendly. So they can actually be working, full time and go to medic school and, have a higher part-time income while in
Absolutely.
nursing school or go to a bridge program. So, but if the end game is RN, the reality is you just got to go. And unfortunately, I don't care what state you're in. In most cases, financially, you're going to do better as an RN if we're looking at just basic level models. And then there's the other things that come along with it. And I mean, again, so this is not me comparing the two professions. It's just when you get asked the question, I got to give you the real answer.
Absolutely.
But as far as the advice, so this is not, it's not to say that I haven't got a lot of advice from a lot of people in the nursing industry. One of my mentors, now that I'm thinking about it, his name was Calvin Posley. He was a ER director when I was a nursing EMS coordinator. And, he was very influential to that time in my life. And he was the person who reminded me that I still had time to do or pursue whatever goals I wanted to. He sat me down one day and he said, you just in the second quarter, as far as life goes. And he said, if you want to pursue administration, pursue administration. But if you want to, be an APRN, then go be an APRN. He said, you just got started and you have time on your side. He said, once you get to your third quarter, you will be where you need to be and you'll be positioning yourself for that fourth quarter. And so basically what he was helping me appreciate is that I imposed a lot of timelines on myself because nursing was technically a second career for me. And his conversation with me was just a reminder that, one, whatever you want to do in nursing, you can do. And it's okay to change what you want to do.
Absolutely.
And that's what I really appreciated. But being that you asked about the piece of advice, I have to give you the best advice I've given in my whole professional career. All
right, hear this.
Yeah, I was a recruit for the City of Atlanta Fire Department. And at the time, he was the lieutenant. Now he's, I think, an assistant chief of the fire department. And he had me outside one day and he said, Moss, they can't hit a moving target. And I was like, at the time, I'm like, man, what is this guy talking about? They can't hit a moving target. And they can be whoever it is you want them to be. But if you're constantly on the move, pursuing your goals and your desires and your aspirations, it's hard for anyone else to bring you down. And so when I hit the station, every opportunity that came up that the city offered, I took. I mean, I took hazmat, I took instructor, I took evaluator, anything that the city would pay for, and even some that I would pay for that they would give me time, I went and took the class. And that mentality has carried over into my time as a medic, and it's carried over into my time as a nurse. And to this day, every time I see him, I say, hey, Chief, I remember you told me they can't hit a moving target, and I've been moving ever since. And it's really been a huge help for my career, my progression. Some people, they always tell me that, they don't know how I do it and they can't keep up. But that's the beauty of it. No one can really keep up with what I'm doing. And I do so much, they don't know where to start. And so most times I get a lot of positivity about my moves throughout the industry. And it's been a huge help to me. So I remember that back in, and that he told me that back in 2004, and I'll never forget it.
Good for you. That is great advice. I think one of the things I always try to encourage nurses to do is keep moving forward, keep learning. and learn, go to the next level, like figure out what is the end game, what do you want to do, and get there. You got time.
Yeah. So I'm sorry. You just reminded me of one more. This is like my big brother. He pinned me in nursing school. And he told me one day that someone called him and said, "Man, what is Everett doing now?" And he said, one thing about it, you may not be able to he may not know what he want to do now, but I tell you, he's definitely going to figure it out because he's not afraid to try. So I would say that that's a bigger piece of advice for anybody in the nursing industry, because anybody who's a nurse, you've met that nurse who hate where they are. They hate where they work. They hate the patients they see, but they won't move.
Doesn't that drive you crazy?
Absolutely.
That drives me crazy. I'm like,
don't be afraid to try something new. As a nurse,
you have so many options.
Yeah. So don't be afraid to try something new. You can stumble upon greatness. Every once in a while, someone has stumbled upon greatness. So don't be miserable and stay there. Move.
Yeah, I tell people that all the time. I worked with people that worked in the same place for 10, 15 years, and they hated it. They hated everything about it. They didn't like the patients they took care of. They didn't like the people they were doing it with. They didn't like anything. And I'm like, go get another job. Go do something else.
Complacency, man.
Absolute complacency. They'd be like, no, I'm an ER nurse. This is what I do. And I'm like, you don't have to be. One of the nurses now works in a clinic, and she loves it. And she's like, if I would have known that this was this great, I would have done this years ago. I'm like, what was stopping you? You were stopping you.
Absolutely.
It drives me crazy when I see people like stay in miserable situations because they're afraid to move.
Yeah.
And I just feel sorry for him. Like I feel sorry for him because, and I've been there. I mean, I've been there where I'm like, there's a job that I had that I was like, oh man, this job is killing me. I need to leave, but I just can't. I can't because I'm not going to make what I'm making. I'm not going to be able to do what I'm doing. This is going to seem like I'm losing here, but really. And then when I left, I was like, man, I couldn't have made a better decision.
Yeah.
Like I just couldn't have made a better decision. It like worked out so well for me that it was, you wonder what took me so long? What took me so long to do this? I very rarely have I looked back in my life and think of the changes that I've had and then turn around and been like, oh yeah, geez, gosh, I really wish I wouldn't have done that. Almost every time things have worked out pretty okay. Mm-hmm. So, and maybe that's the optimist in me that says, if things aren't okay, then I need to make it okay. Right. 'Cause you can do that too.
Exactly.
So yeah, I think that's really, really great advice. Don't get stuck. Keep moving. Mm-hmm. Do something. Like do something to try to make your situation a little bit better.
Yeah, definitely.
That's one of the things. I've seen you post kind of things similar to that in your Instagram a couple times. I'm like, oh, he's just got it. Like, yeah, that's great advice. Just go do something.
That's it.
So that's really, really great advice. So if you were to give advice to a brand new or a paramedic who is looking at getting into nursing and thinking about going to nursing school, what advice would you have?
A paramedic who is thinking about getting into nursing school, don't wait. That would be the first piece of advice. Do not wait. When I graduated paramedic school, myself and two of my buddies said that we were going to go on a nursing school. I looked up, it had been 10 years. So don't wait. Understand that you will be going to learn how to be something else. You're not going to school to learn how to be a better medic or a worse medic or a different medic. You're going to school to learn to be a nurse. Know that going through the door. Of course, Your medic skills are very, very useful. You just have to know how to use them as a nurse. So those would be the two things. Understand that it's a different exam that you're preparing for, and don't wait. Get after it.
That's great advice. Now you're big on certifications. I know you're. I know you got a couple.
Yeah.
What advice do you give nurses that are thinking about taking certification exams?
Stop telling yourself you're a bad test taker. Like, just stop it. Because every time you tell yourself, I'm a bad test taker, you are accepting that defeat. Okay. If you know you're a bad test taker, that's okay, but you don't have to remind yourself every time you get ready to go take a test. Use that knowledge and make changes. Say, okay, I know that I'm quote unquote a bad test taker. Well, why? What about me? What about my test taking has made me believe that? Is it because I can't remember, the right answer? Is it because I don't understand questions? Is it because I can't remember the content? Whatever the answer is, then you need to structure your study habits based upon that. That's one. Two, don't, a lot of, I'd say, senior nurses, and I have mixed opinions and mixed emotions on the whole, oh, well, you hadn't been a nurse long enough to take this. Well, first off, you should only go off of what the company who allows you to take the test says. The board certification of emergency nurses, they say they recommend 2 years. Therefore,
recommend.
Exactly. Therefore, you can take it as soon as you want to. My thing is this: a certification does not say that you are an expert of that subject matter. It says that you have the knowledge on that subject matter. That's all it tells me. It doesn't tell me that you can apply it. It tells me that when you are given this verbal information, you can regurgitate a verbal answer. Therefore, I'm all about challenging yourself. Now, that being said, I don't think a brand new grad emergency nurse who has barely seen 2 patients should run to take the certification of emergency nurses. I just don't think you're setting yourself up for success. Can you do it? Sure. But I don't think you're setting yourself up for success. Now, if after a year you've been at a busy emergency center, you've been studying, you're fresh out of residency, you've excelled, then I personally don't think you should wait another year just because it's recommended. I think that if you feel that you've been exposed to a lot of, because, we used to say this thing at the fire department, when you go to, I went to Station 2. It was one of the busiest stations in the city of Atlanta. So we would say that a year at Station 2 was like dog years. If you went to Station 2 for a year, you were technically 7 years. You were a 7-year firefighter after 1 year. So if you're at a level 1 trauma center, you're seeing, 100,000+ patients a year. You got off orientation, you're working overtime, you're eating it all up. You've managed to get TNCC, you've got EMPC, you have your ACLS, you're just all over it. You know what? I stand behind you 100%. Go take the exam. And be proud of the exam. I think sometimes some nurses put down certification. And I think most of that comes from fear of people not wanting to take the exam or, not or some type of a bad dogma, stigma, whatever the correct word is, on examinations in general. Because I personally feel that certification is a good thing. One, it says that you are concerned about your own professional development. It says that you care at least remotely about being a subject matter expert in that field. And it's a sense of pride. And I get that from fire service. I don't know many firefighters who aren't proud to be a firefighter, and I've carried that with me.
They're a very proud group.
Yeah, and so I carry that. I carry that with me. I'm proud about every profession that I've touched. If there was a way I could have stayed certified as a firefighter comfortably, I would have. I'm about to let one of my certifications go, and I'm struggling with it a little bit, but
which one are you gonna let go?
My flight paramedic certification.
Okay.
The only reason being, to recert is of course a fee, and a lot of nurses say, "Yeah, well, I'd hate to have to pay your recert fees." Well, I didn't do it for that. But to recert my flight paramedic cert when I have my flight nurse cert it just doesn't match where I'm headed. I don't think I think I'll probably renew my flight nurse at least once more, but I have 3 years to go. I got it last year in April, so I have 3 more years before it lapses. I'll be finishing up CRNA school, so I'll probably recert one more time just in case somehow I land a flight job after CRNA school. But I like being certified in the areas that I currently touch.
Yeah. Now, what all certifications do you have?
So I think there may be about 35 or so of us now, but I have all 5 of the board certification of emergency nurse certs, which is certified emergency nurse, trauma certified RN, certified transport RN, certified flight RN, and certified pediatric emergency nurse.
Hoorah.
In addition to that, those 5, I have one more, which is the critical care RN certification.
Now the question I always ask people like you who have all the certs, which one was the hardest?
Again, I'm not a fair person to ask because my previous history, and I say it this way because I truly believe this to be the case. My harder exams were probably not as hard because of what I had been through. Back in 2012, I took my flight paramedic certification. When I tell you I studied hard for that exam, and it was the hardest exam that I ever took, I think that it made every other exam easier. Because the flight paramedic cert is a combination of things from the certified emergency nurse. It has things from a trauma certified RN. It has things from the certified pediatric emergency nurse. It has things from the transport, and it has things from the flight. So all of those exams, there were things on that flight paramedic cert that affected it. So because I studied so hard for it years ago, and because I had to regurgitate some of that information from that exam over the years, when I finally got to the emergency nurse exam, it wasn't as hard. And, I've been an EMS instructor for 13 years now. So regurgitating emergency information was relatively easy. All right. And then my trauma exam, I had TNCC, I had ATCN, and what's another one? TCAR. I had all of that before I took that. And then I think the next exam I took was the flight RN exam. No. I took my CCRN, my critical care exam. Now, I will say that is a hard exam. So no discredit to any of these exams. They're all challenging in their own way. But if I had to rate it as far as the nurse exams go, I would say CCRN is the hardest. And then there's the CEN, then there's the CFRN, CTRN, and then the pediatric one. The pediatric one was easier to me because I have peds experience.
The thing I found, so I used to have the CEN. I didn't keep it because I wasn't working peds.
Okay.
The thing I found about the C pen when I took it, and I took it when it first came out, and then let it lapse. I didn't renew it. What I found was like there were so many prioritization questions. I felt like I was taking the NCLEX.
Yeah, I agree with that.
I remember thinking to myself, I remember walking out of that test going, I'm not sure what just happened. I'd studied pretty well for it. And I felt pretty confident. I was working, part-time in peds at the time that I took it. And I remember walking out of there going, I don't know if I passed or not. I think I passed, but I'm not sure.
Right.
And I walked out and they were like, oh yeah, you passed.
Yeah.
It's like, woo, good job. But it was a little like, I just remember out of all the exams thinking to myself, I'm not really sure how that went.
Mm-hmm. Yeah. So. It was, I was also fortunate that I took ENPC through the ENA. I took that class over because I was actually an ENPC instructor and I didn't renew some paperwork, so I ended up letting it lapse. But I renewed the new edition like a week before I took the CPN. So
that probably helped.
Oh yeah, but tremendously because it was almost like I was taking almost the same exam.
Yeah. Yep. Yeah, that's certainly something I'd like to get back. I have the TCRN, the CEN now, and eventually I'd like to get the CPEN back.
Yeah.
What are your thoughts? So there seems to be a lot of folks focusing on trying to get all 5 BCEN certifications. What are your thoughts on people who don't fly getting the CFRN or the TCRN or CTRN?
Mixed emotions. Because on the one hand, is just knowledge, right? But on the other hand, people like to use their credentials, and the exam alone doesn't make you a flight nurse. Just yes, like sir. The exam alone doesn't make you an emergency nurse. And one thing that I laugh at, and I'm not being judgmental when I say this, but I always giggle a little when someone passes TNCC and they call themselves a trauma nurse.
Yeah.
I mean, I'm not being judgmental by no means, but if you don't really work at a trauma center and you pass TNCC, that doesn't necessarily make you a trauma nurse, because there are trauma nurses who, there shouldn't be many, but there are trauma nurses who haven't taken TNCC or one of the other trauma courses. So I think taking care of trauma patients and having done so is what kind of qualifies you as a trauma nurse. You have a certification in trauma nursing. So to your question, I'm not going to say I have a problem with it, though I do think it sort of waters down its pride in the certification. Let me put it that way. Because, I mean, you look at like CCRN. CCRN says you specifically have to have so many hours taking care of acute or critically ill patients. Now, I like the fact that they don't say in the ICU, because we know that there are some nurses who take care of critical patients in the ER on a regular basis because of our national problem with ER holds. So
all day, every day.
Yeah, so I think that it's fair to allow a nurse who has the knowledge in those areas to take the CCRN. That's my opinion. So I think that if there was a requirement to be either in the area or have worked in the area for, and I'm not saying it has to be a long time, but I just feel that it may give a little bit more validity to having the certification, because I mean, as it stands, if and no, this is not a jab at med-surg, but if a med-surg nurse wanted to go take the CFRN, they very well could. And if they pass, they would bear the certification. But that doesn't say that they can function as a flight nurse. It just says that they were able to answer the questions that were given. Now, in all fairness, too, that these exams are designed to assess the knowledge base. So I can't necessarily be mad that someone who has never flown or transported or worked with peds is able to pass the exam. Kudos to them for having the knowledge.
Anyways, well, the last question I always ask folks is a question I want to ask you, and it's the harder question. But the question's called 3 things. So I'm going to ask you to give me 3 quick things that an ER nurse should always remember, and give me 3 quick things that an ER nurse can just go ahead and forget.
3 quick things that an ER nurse should always remember. Pee when you can. That's number 1.
Amen.
Stay sharp on your assessment skills.
Okay.
And I say this hesitantly, but I kind of stand behind it. Trust your gut. If your gut is telling you something's wrong, I'd rather you act on that than not and wish you had. All right.
Okay.
So those are the 3 things you should remember. 3 things you should forget. Three things you should forget. You said quick. And I'm drawing a blank now. I would say 1, forget what you were told about getting an order to put oxygen on your patient when you were in nursing school. So that I'll go with. Go if your patient need oxygen,
give them oxygen.
Yeah. What does it say? Ask for forgiveness versus permission. All right.
Yes.
That'd be 1. 2, forget about what you were told about EMS. Now, that's one I stand behind, because a lot of non-transitional folks, I'd say talk bad about EMS, but it's just because they don't understand. So I would say forget about any stigmas or stereotypes that you heard about EMS, and truly get to understand what it is that they do. Do you have some people that give EMS a bad name? Absolutely. But there's a lot to learn from EMS.
Absolutely.
3, forget what you thought nursing was and accept it for all that it can be. What I mean by that is sometimes I think when people come into nursing, they have a different picture of what they think nursing is. And I'm not saying that it can't be that, but I'm saying whatever you thought it was, it can be so much more. I mean, nursing is still, to me, one of the most versatile, one of the most, influential position in healthcare. And
absolutely,
if you limit it to the thoughts you had before you got here, then you aren't doing nursing as a profession a favor. What I would encourage every listener to do is to go above and beyond whatever their initial thoughts and goals were, and truly make a difference either in the profession or in the lives of every single patient you touch.
That's great advice. That's really great advice. I like that. I like that a lot. Well, Everett, I can't thank you enough for taking the time to talk to me. I really appreciate it. Where can people find you on social media?
All right. So right now you can find me on Instagram at the Paramurse, at the _Paramurse, THE_PARAMURSE. From there, you can reach any other links that I may have. Right now, that's probably the best way to get me. So come check me out.
Sounds good, man. Thanks again for taking the time to do this with me. I appreciate it.
All right, man. Have a good one.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.